Are you curious about Zosyn and its uses, dose, mechanism of action, and potential side effects? In this comprehensive video, we will delve into the details to provide you with a clear understanding of this widely prescribed medication. Zosyn, also known by its generic name Piperacillin, tazobactam, is an antibiotic commonly used to treat a variety of bacterial infections. Its unique combination of piperacillin, an extended-spectrum penicillin, and tazobactam, a beta-lactamase inhibitor, makes it highly effective against a broad range of bacteria. Understanding the correct dosage of Zosyn is vital for successful treatment. We will discuss recommended doses for different infections and patient populations, helping you ensure the right amount is administered. Additionally, we will uncover the mechanism of action behind Zosyn's effectiveness. By inhibiting bacterial cell wall synthesis and neutralizing bacteria's resistance mechanism, Zosyn helps to eradicate infections. Lastly, we will shed light on potential side effects, enabling you to make informed decisions about treatment. Although generally well tolerated, Zosyn may have some adverse effects that we will explore in detail. Stay tuned for a comprehensive exploration of Zosyn's uses, dose, mechanism of action, and potential side effects. Uses of Zosyn in healthcare. Zosyn is a versatile antibiotic that finds its use in various healthcare settings. It is commonly prescribed for the treatment of intra-abdominal infections, such as appendicitis and peritonitis. Additionally, Zosyn is effective in treating pneumonia, skin and soft tissue infections, urinary tract infections, and complicated infections caused by multi-drug-resistant bacteria. The wide range of bacterial coverage provided by Zosyn makes it a go-to choice for clinicians when faced with challenging infections. It is especially useful in situations where the infecting bacteria are unknown or likely to be resistant to other antibiotics. The combination of piperacillin and tazobactam ensures that Zosyn tackles both gram-positive and gram-negative bacteria effectively. In hospitals, Zosyn is frequently used for empiric therapy in critically ill patients, as it covers a broad spectrum of potential pathogens. Its effectiveness against Pseudomonas aeruginosa, a common and often resistant bacterium, makes it particularly valuable in this setting. Understanding the specific uses of Zosyn helps healthcare professionals tailor treatment regimens to individual patients, ensuring the best possible outcomes. Understanding the mechanism of action of Zosyn. To fully appreciate how Zosyn works, it is important to understand its two main components: piperacillin and tazobactam. Piperacillin is an extended-spectrum penicillin that inhibits bacterial cell wall synthesis by targeting penicillin-binding proteins, PBPs. By interfering with the formation of the bacterial cell wall, Zosyn weakens the integrity of the bacteria, leading to their eventual death. Tazobactam, on the other hand, is a beta-lactamase inhibitor. Beta-lactamases are enzymes produced by bacteria that confer resistance to beta-lactam antibiotics. By inhibiting these enzymes, tazobactam prevents the breakdown of piperacillin, allowing it to remain effective against bacteria that produce beta-lactamases. The combination of piperacillin and tazobactam in Zosyn provides a synergistic effect, ensuring a broader spectrum of activity against various bacteria. This mechanism of action makes Zosyn highly effective in eradicating bacterial infections. Dosage guidelines for Zosyn. Determining the appropriate dosage of Zosyn is crucial to ensure optimal therapeutic outcomes while minimizing the risk of side effects. The dosage of Zosyn varies depending on the type and severity of the infection, as well as the patient's renal function. For most infections, Zosyn is typically administered intravenously every 6 to 8 hours. The recommended dosage ranges from 3.375 grams to 4.5 grams, depending on the specific indication. In severe infections or those caused by resistant organisms, higher doses may be required. It is important to adjust the dosage in patients with impaired renal function, as Zosyn is primarily eliminated through the kidneys. Reduced doses are necessary to prevent drug accumulation and potential toxicity. Regular monitoring of renal function and dose adjustments are crucial in these patients. Pediatric patients also require dosage adjustments based on their age and weight. The healthcare provider will calculate the appropriate dose based on these factors to ensure safe and effective treatment. Always follow the prescribed dosage and duration of treatment as directed by your healthcare professional. Potential side effects and precautions of Zosyn. While Zosyn is generally well tolerated, like any medication, it can have potential side effects. It is important to be aware of these side effects to monitor for any adverse reactions during treatment. The most common side effects of Zosyn include diarrhea, nausea, vomiting, and rash. These are usually mild and resolve on their own without intervention. However, if these symptoms persist or worsen, it is important to consult your healthcare provider. In rare cases, Zosyn can cause more serious side effects. These may include severe allergic reactions, such as anaphylaxis, which require immediate medical attention. Other rare but potentially serious side effects include liver dysfunction, blood disorders, and kidney problems. If you experience any unusual symptoms or have concerns, it is important to seek medical advice promptly. It is also important to consider potential drug interactions and precautions when taking Zosyn. Zosyn may interact with other medications, such as certain anticoagulants, leading to increased or decreased effectiveness. It is essential to inform your healthcare provider about all the medications, including over-the-counter drugs and supplements, that you are taking. Zosyn should be used with caution in individuals with a history of allergies, renal impairment, or liver disease. Your healthcare provider will assess the risks and benefits of Zosyn treatment in these situations and may adjust the dosage or consider alternative treatment options. As with any medication, it is important to follow the guidance of your healthcare provider and report any concerns or side effects promptly. Drug interactions with Zosyn. It is important to be aware of potential drug interactions when taking Zosyn. Certain medications can affect the effectiveness or increase the risk of side effects when used concomitantly with Zosyn. One notable interaction is with certain anticoagulants, such as warfarin. Zosyn may enhance the anticoagulant effect of warfarin, leading to an increased risk of bleeding. Regular monitoring of coagulation parameters is essential in individuals taking both Zosyn and warfarin. Other medications, such as probenecid, can increase the blood levels of Zosyn by decreasing its elimination. This can potentially lead to higher concentrations of the drug in the body, increasing the risk of side effects. Close monitoring is necessary when using Zosyn with probenecid. It is crucial to inform your healthcare provider about all the medications you are taking, including prescription drugs, over-the-counter medications, and herbal supplements. This will help ensure that potential drug interactions are identified and appropriate precautions are taken. Frequently asked questions about Zosyn. Can Zosyn be administered orally? No, Zosyn is not available in oral form. It is only administered intravenously due to its poor oral bioavailability. Can Zosyn be used during pregnancy? Zosyn should be used during pregnancy only if clearly needed and under the supervision of a healthcare professional. The potential benefits and risks should be carefully considered before initiating treatment. Can Zosyn be used in pediatric patients? Yes, Zosyn can be used in pediatric patients. However, the dosage should be adjusted based on the child's age and weight. Pediatric patients should be closely monitored for any potential side effects. How long does Zosyn treatment typically last? The duration of Zosyn treatment depends on the type and severity of the infection. It can range from a few days to several weeks. It is important to complete the full course of treatment as prescribed by your healthcare provider. Can Zosyn cause antibiotic resistance? While the use of any antibiotic can contribute to the development of antibiotic resistance, the combination of piperacillin and tazobactam in Zosyn helps to minimize this risk. Tazobactam effectively inhibits beta-lactamase enzymes, which are responsible for antibiotic resistance in many bacteria. Alternatives to Zosyn. In situations where Zosyn is not suitable or contraindicated, there are alternative antibiotics that can be considered. The choice of alternative will depend on the specific infection, bacterial susceptibility, and patient factors. One alternative to Zosyn is cefepime, a broad-spectrum cephalosporin antibiotic. Cefepime has a similar spectrum of activity and is effective against many gram-positive and gram-negative bacteria. However, it does not provide the beta-lactamase inhibitor component found in Zosyn. Another alternative is meropenem, a carbapenem antibiotic. Meropenem has a broader spectrum of activity compared to Zosyn and is particularly effective against multi-drug-resistant bacteria. It is often reserved for serious infections or when other antibiotics have failed. Your healthcare provider will determine the most appropriate alternative antibiotic based on the specific clinical scenario and the local resistance patterns of bacteria in your region. Conclusion and final thoughts on Zosyn. Zosyn, or piperacillin, tazobactam, is a widely used antibiotic that provides a broad spectrum of activity against various bacterial infections. Its combination of piperacillin and tazobactam ensures efficacy against a wide range of gram-positive and gram-negative bacteria. Understanding the correct dosage and mechanism of action of Zosyn is crucial for successful treatment. It is important to follow the prescribed dosage and duration of treatment as directed by your healthcare professional to optimize therapeutic outcomes. While Zosyn is generally well tolerated, it is important to be aware of potential side effects and drug interactions. Promptly reporting any concerns or side effects to your healthcare provider is essential for appropriate management. In situations where Zosyn is not suitable or contraindicated, there are alternative antibiotics available that can be considered. Always consult with your healthcare provider for personalized advice and recommendations regarding the use of Zosyn or any other medication. Thanks for watching.